Hi, I'm with Carrie, registered dietitian at St. John's, and we're just going to go over how a patient should deal with diet, nutrition, and appetite after surgery. So, Carrie, what are the keys to a successful approach to diet nutrition in the post-surgical period?
So I think often if your appetite is kind of not as what it was previously, the biggest thing is making sure you have small, frequent meals. And often, with the hospital, they do offer you snacks and that sort of thing. So be sure to ask for those if you would like any. But I would say making sure you're eating within 1 hour of waking up. That sort of kickstarts those hormones that help control your appetite, control how full you are. So we want to get those working back normally. And then from there, making sure you're incorporating protein at every meal. That's really going to help with that healing process, and doing a little bit more than you would normally because you just had this surgery. So your body's going to be a bit more stressed than normal. So we do want to make sure we're getting that nutrition in to help sort of decrease that inflammation process.
Well, one of the most common things that we hear is that patients just don't have an appetite. And these are patients who never had a problem with eating prior to surgery, and so it makes them panic. What would you tell them about this temporary change in appetite and how they should try to improve that?
I would say for the temporary change in appetite, I would encourage, let them know that it's normal for that to happen, but just to kind of go with it and to eat even small bites is better than nothing at all, because the longer they go without eating, the harder it is for their appetite to come back. So we really want to encourage them to just have a protein shake, have a glass of water. All of those things can help to trigger your appetite. If it's nausea, ask for some ginger or lemon tea. All of those things help to settle your stomach. So really looking at, because your stomach is empty, you're probably going to be less likely to want to eat, or the loss of appetite might feel even worse. So we want to add some food there first to kind of fill you up and make you feel better.
So even if you're not hungry and eating is the last thing that you want to do, it's not a bad idea just to have a little bit to kickstart the system, to prime the system.
Definitely, yeah. So
it doesn't have to be a big meal,
no,
just a small one.
It could just be a half of a banana. It could be some crackers with peanut butter. We just want to get something in there, and you'll find if you get something in, it tends to perk your appetite up, and you'll find that you may get hungry as the day goes by.
Great. Two topics I want to cover is another big issue afterwards is constipation.
Mm-hmm.
And it's hard, the food changes, the medications slow down the bowels. How can a patient use diet and nutrition to decrease the symptoms or issues of constipation?
The two biggest things with constipation that people often don't get is water and fiber. So you can take all the fiber supplements you want or eat all the high fiber foods you want, but if you're not drinking enough water, it's going to make your constipation worse. So you really want to make sure that if you're taking stool softeners, if you're taking Miralax, anything like that, you need to have water. That water is going to bind in there with the fiber and to make the stool softer, easier to pass. So hydration is going to be one of the most important things you can do. I recommend at least 2 liters of water a day. In terms of food, the fiber, and we're looking for soluble fiber, so that's going to be things in like oats and beans and lentils. That fiber kind of softens, get things moving. Insoluble fiber is kind of the propellant. It kind of gets things moving through your gut. So that's in like raw fruits and vegetables. So getting some of those in can really help to balance out the bowel movements.
So constipation isn't a problem for everybody, but if you have a history of constipation and those patients know who they are, they have to be very deliberate about these issues.
Yes.
About taking an adequate amount of fiber and really being deliberate about drinking water. 2 liters is a lot of water.
Yeah, I mean, I think it's more about sipping throughout the day, and the best judgment of like how hydrated you are is to really look at your urine. If your urine is a really concentrated dark yellow, you're not getting enough fluids in, you need to start drinking more water. When we're sensing thirst, our body is already dehydrated, so we have to kind of drink ahead of our thirst.
Okay, and 2 liters.
Mm-hmm.
Okay.
About, and it could be more or less depending on how much you weigh, all those things. If you have a fluid restriction, it might be a little less, but
the final thing that patients often ask us about is, what can I eat to make sure I get the best possible recovery in terms of macronutrients, and what kind of things do I need specifically post-surgically in terms of micronutrient? What do you tell patients to maximize recovery?
So to maximize recovery after surgery, I always recommend protein, like we talked about previously, protein is the building block of life. So it's really going to help the surgical site to heal better, faster. In terms of micronutrients, vitamin C is kind of like a building block for our skin, for our connective tissue. So we want to make sure we're getting vitamin C. Another micronutrient would be zinc. That can also help. And then in certain situations, vitamin A would be another one. So you could certainly take a multivitamin, and that would provide you all of those things. If you were looking for specific foods, vitamin C is in a lot of fruits and vegetables, so really just making sure you're getting those fruits and vegetables. And zinc is going to be in some protein, some nuts and seeds. So you'll be able to get it if you are following kind of a well-rounded plant-based diet.
And eating after surgery has to be very deliberate. So if a person's not hungry and they just do not feel like eating that protein or that protein shake, they should still do it.
Definitely. Even if it's just like 3 sips of it. I always say, even if it's like a quarter of the drink, that's better than getting nothing at all. And often people tend to be surprised at how much better they feel once they get that in, and then it kind of makes them want to have a little bit more. So it's kind of like forcing yourself to do it a little bit, understanding that the nutrients are healing you from the inside out, and that's really the most like empowering thing to think about, is what it's going to do for you from the inside out versus like, oh, I just don't feel like it. Think about, how do you want your healing to be faster? Do you want to feel better faster, get back to your usual activities faster? The nutrition will play such a huge role in all of that.
So the 3 main things. So the loss of appetite is normal, and you can manage that by tricking the system into taking small, frequent meals. Just get started. In terms of constipation, it's important to be very deliberate about hydration and fiber. So even if you're not thirsty, you just keep drinking water, more than you ordinarily would. Okay. And then about doing the best things possible, it's making sure you take protein. Whether whole foods are best, meat, what you said, fish and poultry, and plant-based proteins are best. And supplements are also a good alternative if you can't do that. And micronutrients, zinc, vitamin C, vitamin A. Okay, great. Well, thank you very much.
You're welcome.